Thank you, Professor Dimitrievich. And we are waiting for discussion. Next presentation will be given by 3 speakers. First will be Boris Šuštaršič. Then I will tell you something about medical programs in Rehabilitation Center Dom, and Aleša Kloosterwaard will tell you about physiotherapy program. Mr. Boris Šuštaršič is the founder of Rehabilitation Center Dom. And at this place, I would like, in the name of all Slovenian MD people, I would like to thank him for the establishment of this rehabilitation center, and that Slovenian NMD people have the opportunity to have rehabilitation programs there. Boris, really, thank you very much for this. And please, tell us about the beginning of Rehabilitation Center Dom.
Thank you very much for kind words. Of course, there is always spiritus movens, spiritus agents, and so on. So I have done this work, but of course, the results are the efforts of a lot of people, not only me personally. The title of this lecture is Maintenance of Biological Potential of People with NMD in Rehabilitation. Of course, I'm not going to talk about medical sciences, but I would like to say in a few sentences how people with neuromuscular disorders can see this beautiful world. Well, I will try to shortly to say this. The Muscular Dystrophy Association of Slovenia was established in 1970, influenced by an increasing number of information on the activities of America and British muscular dystrophy associations. From the very beginning, we were aware of the key needs of persons with neuromuscular disorders, which included appropriate medical treatment, adaptive transportation, personal assistance, quality education, employment, accommodation, living environment, etc. In the realization of the above needs, we were immediately directly faced with the cruel reality of progressive disability that arises from neuromuscular disorders: shorter life expectancy, dependence on physical assistance from other persons, use of electric, wheelchair, and other technical devices. All these and many other aspects affect the life of each person with neuromuscular disorders. Therefore, the Muscular Dystrophy Association of Slovenia has focused its activity on the obtainable forms of medical treatment that can preserve the biological potential of persons with neuromuscular disorders and prevent secondary disorders despite the severe consequences of this disease. The Institute of Clinical Neurophysiology and its founder, Professor Dr. Dimitrievich, have contributed significantly to the systematic medical treatment of persons with neuromuscular disorders, diagnosis, adjustable medical interventions, and so on. But on the other side, the Muscular Dystrophy Association of Slovenia has achieved the enactment of our right to free health care and electric wheelchairs. Since existing healthy spa could not provide appropriate medical rehabilitation to persons with neuromuscular disorders, mostly due to the inappropriate spatial conditions, the association decided to purchase the premises of the abandoned hospital situated on the Slovenian coast and raise the necessary funds also through public resources. After the purchase in 1985, the hospital was gradually renovated and organized in a coastal non-hospital rehabilitation center where the indications are determined by physicians and physiotherapy is carried out by qualified professional staff. The Rehabilitation Center in Izola is managed as a company on the market, which means that in addition to its primary mission to preserve health and enable an active life, it also yields economic results such as surplus of income or expenditure, which is, of course, fully invested in the modernization of the center and the staff training. Well, I think it's enough. The other words I give to my colleagues.
And now I will tell you something about rehabilitation programs. We have programs for muscular weakness, contractures, scoliosis, respiratory insufficiency, cardiac affection, nutrition disturbances, dependence on the help of others, and of course for possible social isolation and psychological problems. At the first day of rehabilitation, everyone has clinical examination with spirometry, ECG, and functional assessment. Then all next days, there is a physiotherapy program. We assess functional state by a test protocol, consists of 10 tests for simple functional movements, complex functional activities, vital functions, and degree of contractures. We treat muscular weakness by active or active-assisted exercises. These exercises should be dynamic and isometric. Swimming is very good activity, very good exercise for NMD people. Exercises should be performed every day and in children like a game. An example of active-assisted exercises. Then regarding contractures, stretching is performed, passive exercises, and use of different devices. Walking is an excellent activity to prevent contractures. Walking with the help or just under the control of a physiotherapist. And then we use different walkers, different standing devices, and if possible, application of heat before treatment is done. Swivel walker is an excellent device to prevent contractures and to enable walking, especially in children with SMA. Standing device and special device for stretching contractures in hips, knees, ankles, and elbows at the same time. Then for scoliosis, We perform active exercises for trunk muscles. Respiratory exercises are very good to prevent scoliosis. Then then correction of sitting, spinal orthosis, or especially made seat. What is proper sitting? Proper sitting should be upright. Important is the position of the head, position of the spine with hyperlordosis in lumbar part of the spine, position of the pelvis, of upper and lower limbs, and we use special additions to ensure proper sitting. Lumbar lordosis, then anchorage for the pelvis, and correction of the scoliosis to put something under the buttock or with spinal support. Respiratory problems, respiratory exercises, we perform them in the park, on the beach, then insufflations, procedures for cleaning airways, various techniques, cough machine, and of course assisted ventilation. This is our cough machine from Dom 2 Topola Isola, and we use this cough machine more than 20 years, I think more than 25 years, and this was the first machine in Slovenia, and we have nice results, especially in patients with ALS. Regarding cardiac problems, everyone who comes to rehabilitation programs has ECG, and then after clinical examination and ECG, we send someone to echocardiography or examination by cardiologist, and of course proper therapy when needed. Circulatory problems, lymphatic drainage, manual machine, manual massage, cryotherapy, electrotherapy, and hydrotherapy. An example of lymphatic drainage, manual massage. Then for pain, cryotherapy, electrotherapy, manual massage, hydrotherapy, cautious passive exercises, and of course analgesics. Dependence on the help of others, different instructions. We also published a book about this for nutritional disturbances, obesity, malnutrition, constipation, etc. Balanced nutrition with enough proteins and vitamins, if necessary, nutritional supplements, if necessary, laxatives, and we recommend drinking enough liquid, enough water, especially in warm days during the summer. For social and psychological problems, we stimulate numerous social contacts. There are music performances at Dom 2 Topola, drama evenings, various board games, trips, etc. The town Isola is very near. The center of the town is near our rehabilitation center, and people can go to the town, and everything in the town is adapted for wheelchairs. Thank you. Aleša.
Hello, everybody. Are you still awake? Okay, this is the last presentation. I'd like to welcome all of you. I'm Aleša Kloosterwaard, and I'm a physical therapist in Isola Dom 2 Topola. So I bet everybody in this room already heard about physical therapy, or at least they were treated once or maybe heard about it. But there are so many different kinds of physical therapy methods. So here I would like to present our restorative rehabilitation program. So maybe some of you will hear something new and learn something new today. So let's start. I'm a little bit nervous, so go easy on me. All right. So each year, our restorative rehabilitation program starts in April, and it ends in mid of October. And over 450 patients are divided in 10 groups. In each group, there are like 50 till 60 patients. Some of them, they stay 2 weeks, and some of them 3 weeks. Every patient gets 45 minutes of individual physical therapy, 20 minutes of manual massage, group breathing exercises, and other therapies prescribed by the doctor, like electrotherapy and stuff like that, and of course swimming. Our team consists of 2 physical therapists. I don't know if you can. Here is also Martina Sardoc. She's also has a great major role in physical therapist in the last 20 years. Unfortunately, she couldn't be here today. And the rest of them are apprentice trainees, students, and massage therapists. So it can vary from 7 till 15 employees in one summer. Here are some facilities, like the gym. We have a lot of equipment. This is the biggest room we have. Then next are 3 smaller treatment rooms for people who need to be less distracted. For example, children and elderly people. This is the room where all the magic happens, actually all the administration. So, I mean, everything what concerns about intakes, when patients have to discuss about anything, so they come in this room. Here's the picture of Hubbard bath, and of course, outdoor swimming pool. When a patient comes, we make a physical therapy program based on these factors. For example, a therapy can totally be different for a child or for an elderly people or for somebody who can walk, somebody who doesn't walk. So based on this factor, we make a program for them. So what are our therapeutic goals? Our goals are to optimize a person's strength, function, and comfort, to provide a detailed analysis of abnormal movement, for example, gait analysis like how to walk, designing and monitoring a therapeutic exercise regime, and provide training and energy conservation and time management techniques. All of these goals have to be adjusted, what I just said before, based on these factors, what I just said. Another important task is respiratory therapy. And here we monitor respiratory function, for example, like measuring vital capacity and measuring forced vital capacity. We have to advise on techniques to assist with the breathing exercises and advise on methods on clearing secretion. We have to assist with the breathing management. Here's the picture of breathing exercises we do every day in the park at 9 o'clock. Everybody has to be present, otherwise they don't get dessert. I'm just kidding. So another one is, consequences by patients when they sit all day in a wheelchair. It can develop contractures and consequently also deformities. So our job is to minimize this development and minimize other secondary complications. Another important role we have is to facilitate independence in activities of daily living, and also with that educate, advise, consult parents, family, and relatives. So here you see our methods. We have a lot of methods we use. For example, kinesiotherapy. Dr. Zupan already mentioned a little bit about exercises, active assisted. We use manual therapy, for example, mobilization traction, elements of neurodevelopmental treatment, respiratory therapy, hydrotherapy. Here you can see also 2 pictures of standing device and cycloergometer. Urshka, that is you. Another one, electrotherapy, thermotherapy, cryotherapy, but these are all the methods that are prescribed by the doctor. And of course, last but not least, manual massage, which takes 20 minutes, what I already said before. So what makes our physical therapy program different from the other? I think it's very important, the climate, because it influences positive on well-being and breathing. It's the location in Isola, it's directed directly by the sea. It's the good accessibility, like in the park, in the house, on the beach, and the city center. And it's the friendly atmosphere we have, staff with patients, because some of the patients are coming here already from their birth, or early childhood, so they come every year for 20 years, so they have to feel comfortable, and also the staff also feels really homely and friendly with them. And what is actually the result of all of this? That every patient is satisfied and happy, so they look forward to come back next year. So that was my part. I think it's time to stop for me. I would like to thank you for listening. If anybody has any question, you're welcome.
We came to the end of this session. I invite all speakers to come here, and the audience for the questions. Please come. Yeah.
Barking all day, only 1, 2, 3, 4, 5, 6 dogs.
Milica, please.
Thank you. I'm very happy to hear all this afternoon, and to hear practical things for use. And my worry is about the future. I want to know, is it the situation in other countries? For example, in Croatia, in the last few years, many people with ALS are going to China on stem therapy and stem cells therapy. And sometimes they ask me what to do. Of course, I don't know answer, but it is very costly, and what I have informations, the results are very bad. What is experience in other countries, and what you can suggest us?
Because this is not considered as a treatment yet. There's ongoing trials of different kinds all over the world which didn't finish yet. So whenever a drug or kind of treatment has not an established effect, it's not assumed to be treatment. That's why it is China, it is Mexico, it is countries like this when they can do such things. While in Western countries, I believe this is not a treatment yet. This is our advice to our patients. Some of them, they went to China as well.
Yes, I would say the same, actually. I don't look after patients with ALS myself, but in the UK, it's very much supportive management. So I think it's pretty much the same as we've heard with non-invasive ventilation, cough assist type of techniques. And I have to say, I really wish we had a lovely rehabilitation centre like the one you have here in the UK. It just looks amazing. We don't have any facility like that, so I think it looks really good.
May I do a short comment? May I? Let me say, I am a general pathologist, and from the point of view of regeneration, skeletal muscle is expected to gain a lot for any mass-related research activity on regeneration and therefore stem cells. But even skin, which every day regenerate, poorly recovered by restorative, regenerative stem cells approaches. Up to the time that our chairman do not have 1 meter of hair, I don't believe that stem cells approaches will be successful. Because what is much easier than expect wonderful result in recovering the hair? They grow every day, but if there are some problems, no one is able to obtain good results. I am not talking of teeth. I am not talking of neurons. I am talking of trivial problem of the skin. Unfortunately, up to now, these magic events related to stemness did not provide the results that are expected to do. Wait for his hairs before going to China.
Can I tell you something? A practical advice, very practical. If you do not have solution for curing a condition, then you have all kinds of offers and so on. This is why you have your association. And your association has also medical advisory board, and this board has a criteria for treatment, etc. You define this. Now, people are going to go to South Africa, to Peking, and everywhere. It's nothing wrong. Only what you good to do, to see this patient before they leave, and see the patient before they come. Not to be biased, not to make any enemies and so on. Just help us to see what kind of accomplishment can happen. This simple regulatory mechanism from your society and so on help, you will see, tremendously, because all this tension now. I remember when I've been a young resident how cancer was treated in Yugoslavia from Bosnia with the gasoline, drinking gasoline. I can tell you I've been following very, very close stem cells. Stem cell injected to the spinal fluid, in the spinal cord injury people, in the blood for old generation and so on. Definitely, they have an early effect in increasing excitability and all secondary effect of the nervous system from this, which does not last more than 6 weeks and going down if you carefully examine. 3 years ago, Winfried, when we had our meeting in Vienna, we invited all our Chinese colleagues together with our best neuroscientists in Vienna and discuss also stem cells and so on. I had the privilege then, after this meeting, to see 84 video of patients who been treated in China, and so on, and so on. Definitely, there are some effects, but not effect of cellular attachment and so on, but effect of immune response to this. But that's not time for you as association to discuss. For you it is, this is what we have, acceptable. We are very happy also to learn what was the effect, whatever they do, if you know protocol, because you can benefit from this. Thank you.
Yeah, actually, I'm just going to say one more point as well, and that is that for a lot of these newer potential treatments that are still in the laboratory, we really need proper randomized control trials. So for studies of stem cells and gene therapy, it needs to be studied properly. We need to make sure there are no potential harms to those therapies, from those therapies, and we need to make sure they're effective. Because I know actually there are families who spend a lot of money going abroad to get these treatments that haven't really been properly tested. So I would say to people, you know, look at the evidence. We've got to get the evidence first.
Me too. I would add that research is mandatory. Research ought to be supported even with patient help. This is a world goal. Hope that in 6 months some miracle happens. This is another story. Research, yes. Pay tickets to China, it is not a good idea.
But I think what you're saying is important to never tell to the patient that you do not have a treatment for him. Treatment and cure, they are two different things. And you do have a treatment. And this kind of treatment you have. We learn from where is a physical therapist, about what she does with all these things. There are physical and so on. So treatment is available even to ALS patients. And this is what you have. And you are going to have treatment which your colleagues who are involved in this know how to treat. But if they like some additional one, then send to Padova.
Hello, good evening. I have a question about food supplements. We read about marijuana oil, marijuana derivatives, any kind of information on the web. So I have a question for our experts. Is there any existing clinical trials, or this is just a commercial approach like the treatment in ALS in China or, I don't know, India? Thank you.
I'm really not very knowledgeable on the literature on this marijuana use, but this is the question that is commonly posed to me at the outpatient clinics. So it is kind of legalized, or was legalized recently in Slovenia. I believe the drug is not yet available at the pharmacy. But my position, which is not coming from reading or studying this in more detail, is it is used, for example, to treat spasticity. We have many other drugs to treat spasticity, which are available for years, and we know of side effects and everything else. There is, it is used to treat pain. There are so many painkiller drugs available, which may be better. But I don't know really.
Professor, if I understood well, Chinese people showed about 87 patients. They were anyone from China or only from the other countries which are paying so much money to go to China? In a normal situation will be that China is paying to patients to come for their experiment in China.
They have been from different parts of the world. All others have been Chinese, and it's interesting that also mother of neurosurgeon who does this was injected in brain because she became demented. I mean, this naiveness is going so far that you do intervention also to your mother. It was also of interest to find out that one patient with amyotrophic lateral sclerosis was coming for 2 years, every 6 months, the conditions start to go back, and but when you try to find the criteria for disease and so on, it was a question if it was ALS, but it was probably some kind of myelopathy. But anyhow, only 12 from, and they all paid this to come there. Now, China also organized a restauratology. It's their strong association, which has every 2-year meeting, and mainly the members are coming from Arabian countries, some from United States, some from Europe. And the last one I attended was in Bucharest, in Romania, and discussion about providing evidences for diagnosis, for assessment, been always not successful to come to the end. They do have also a new journal, open journal, on the restauratology, and trying to publish it. They have problems in publishing because the assessment by peer review doesn't work very well. It's an interesting speculation, but probably some evidences are there. Approximately 10 years when this kind of politics between success of China and success of the United States, then the government decided that spinal cord injury will be a model to be shown that China can solve the problem which the United States cannot. And there was some financial support and so, but it's not the case more. But beginning of this, in speculation, I attended, some of my colleagues went there, and I attended only one meeting so far. And these Chinese colleagues become my friends, and I like them, and we don't talk about their success.
May I add something? Well, it came onto my mind now because of the interest from the audience on the stem cell therapy, that there is this famous story of an Israeli patient with ALS who was cured, who improved very much after such treatment. But this was not a pure ALS patient. This was a patient who was having myasthenia gravis as well as ALS, so two neuromuscular conditions. And nobody knows which one was cured, because the idea behind stem cell therapy in ALS is actually to nourish what is diseased, these diseased nerve cells. And it has at least two effects. One is through neurotrophic factors, and the other one is through affecting the immune system. Myasthenia gravis is a disimmune disease. Perhaps patients need some explanation in this case. They are asking this.
You see, it's a very simple rule. Respect whatever others are telling, but don't use it unless there are hard evidences. Because this, what we are experiencing now with cellular therapy and so on, is going to bring many new observations and findings. But we are not going to recommend this patient to be treated. But open-minded, but it's fine. If they have an ethical and moral question resolved and so on, but not repeat this thing until hard evidences.
There mentioned the influence on the immune system, like something what is possible. Are existing any experience about using beta-glucan, for example? Anyone?
I don't like to bark more. But, and I didn't hear you because I have the doctor's one.
Do you have any experiences for about beta-glucan using for strengthening the immune system?
In 1958, I've been coming from Sweden and make a stop to Copenhagen, where was a Professor Buchtal, who was strong German, teaching everybody electromyography. And I asked him, Professor, do you have any experiences? He said, young colleague, there are no experiences more. There's only evidences. So experience doesn't mean very much. Okay. But observation, finding, under what condition and so on, I think there exists. You know, there is a very nice published evidences in Journal of Rehabilitation in the United States. At the beginning, when Chinese started to work this, there have been problems. One patient died, or the allergic response, and so on. But now they know how to do with this. There are no more problems. But it's a very nice evidences what has happened. At that time, they've been invited to observe, and when they reported about this thing, the Chinese have been angry about it. So there are evidences.
Any other question? Some comments?
Maybe I should add, because if this was the question on ALS treatment, was it? No. There were trials. There were trials that were trying to influence the immune system in this condition. It is known that the inflammatory cells are there, and no results actually, no treatment success.
I think it's time to end, huh?
Okay.
I have a picture for end,
Yeah.
if you allow to me.
Please.
Is anybody who knows how to do this? I prepared for today. I'm a happy father, and I have two daughters, and one of them is an artist, and she does sculptures, paintings, and so on. And of course, daughters and boys are always younger than father. But anyhow, this doesn't limit our discussion. And I've been discussing here about muscular dystrophy because it's a not only interesting medical problem, it's also interesting conceptual problem. It is also human problem. It's also philosophical problem because there are many, many things. And for artists, so I told her where we are today, and this is her first interpretation. And rain, this water, means time. And our Gower sign, if we find in children that they are climbing on their thing, we say, we know what it is. It's a Duchenne dystrophy, or whatever we decide to call it. Then this was today thing which we clarified, that we know how to recognize, how to diagnose, how many different forms, we understand heritage more and more, and probably tomorrow we should try to provide facilitation toward diagnostic can be used also as an assessment procedure. And that's, I think, very important step which I expect to happen. Now, where we are, this is excessive, but we are allowed, not in Europe, in your place you're trying to do, but we are allowed in, yes. Yes, thank you. Why you didn't come earlier? I'm a very attractive man, don't I must always say to the lady that I'm attractive, they don't recognize. but in muscular dystrophy we recognized. Anyhow, this is what we are trying to stop. We are going to guide, to lead responses, not to happen. That's over. Like your walking therapy. You don't wait there, but so this is forbidden. Now, can we do this with orthotic devices, by lifting different things and so on? We can, but we can do much better if this is a part of modification of the motor control which exists there. And therefore, you see these big legs with all these orthoses. I mean, Venus was doing this very well. But can we do different? And yes, motor control is behind this tail. But it is the secret of motor control of spinal brain, spinal cord, brainstem, which you have a right to divide by your afferent input, and not to wait that this will happen after cure. You saw how many people in your hands become much more better than you expected. Yeah, and this is the end of the story of today. So let us move to improve what we have and stop waiting to pray for it. Pray doesn't help. Thank you.
Thank you, Professor Dmitrievich, and all speakers in this session. So we came to the end. Only one thing still, Mr. Šuštaršič, President of EAMDA, will give summary of this day.
Well, ladies and gentlemen, after such beautiful conclusions of Professor Dmitrievich, I would say there is no need for additional summary. I will use the words from basketball. Let's take time out until tomorrow morning. We still have a roundtable discussion about the sciences of neuromuscular disorders. And there, can we say, another summary or something else. But I will take this advantage that I can have the last word today, and will thank you very, very much for our lecturers who have given the best knowledge they have, and I hope that they have opened the path to new kinds of treatment and perhaps also the cure of progressive neuromuscular disorders. But the best thought, nevertheless, was the words of Professor Carrara: let's integrate several branches and technology achievements together. Thank you very much, pleasant evening, and please come tomorrow around table discussion. Good night.
Good night.